So Marlene, you remember when you were diagnosed with lung cancer and how you felt at the time?
I was diagnosed with lung cancer back in 2004, and I developed a cough that wouldn't go away. I ignored it because I had my family physician prescribe a cough medicine that tendered it down. And then I had been spitting up blood, and the family physician contacted you.
So once we made the diagnosis that the reason you were coughing up blood was this, you had a lung cancer, how did that go with your relatives and your family? What was the reaction?
Once we found out I had cancer, immediate reaction from my daughter and my husband was, she's going to die. My relatives, I didn't tell them right away.
So back then when we diagnosed the lung cancer, do you remember what happened next, what tests we did, how we evolved into your treatments?
Back then when I was diagnosed with lung cancer, I was called in for a series of tests on breathing machines. It was an all-day affair. We made an appointment to have thoracic exploratory to find out exactly where this mass was going, how big it was, what you could do about it. After that, you gave me a treatment plan and told me what my options were, and I went into chemotherapy.
So one of the options that we had presented to you was either to go straight to surgery, which at the time was the standard, or to give you the opportunity to participate in a national lung cancer trial that was evaluating the role of maybe giving chemotherapy before surgery.
Right.
That's right.
That's what happened.
And it was basically neither you or I were to decide. If you accepted to go on this trial, it was going to be a flip of the coin that was going to decide for both you and I whether you want to go straight to surgery or whether you were going to go to chemotherapy first and then come back hopefully for surgery.
Right.
That's correct. And if I recall, you did decide to go on this trial and the coin flipped and you randomized to the arm of getting chemotherapy first.
That's right.
So going back then, do you remember were you aware of these trials that existed in cancer trial or cancer treatment before you had met me?
I wasn't aware of any trials for lung cancer, but I was aware of trials for other cancers.
Okay. And when I presented to you the option of participating in this trial, just why did you decide to go on trial? A lot of patients don't want to go and be treated on trial. They decide, I want to be treated the way I should be treated. This flip of the coin business, a lot of the patients are not very comfortable with that. Do you recall why is it that you said, you know what, I'm going to go on this trial?
I decided to go on this trial through my faith, through my belief system that says it's not the event that's going to give me the feeling of should I or shouldn't I, but it's what I believe about the event. And for me, it was a door opening up that I wasn't going to leave shut. I went home and thought about the decision I was going to make. It had to be my decision. My husband and my daughter made it very clear. This is your decision, and we will support you either way. And I immediately said, I'm doing it. I'm going for it. It's a gift. It's a gift. I did consider people behind me that are going to be facing lung cancer. And I felt absolutely privileged to be able to lead, the way for those people too. Never did I feel like a guinea pig, ever, never. I felt like a leader.
So you just mentioned the word guinea pig, and a lot of individuals out there with cancer, when presented with the option of participating in a trial, it's the way they feel. They feel that they're being considered as guinea pigs. Why was that different for you?
Being able to participate in the trial gave me significance in my life and I kept my eye on the disease. I didn't listen to outside people. I listened to you. I got on the internet and found every bit of information I could find about lung cancer and trials, and I kept my focus on this disease and the recovery from it.
So, having participated in this trial, and again, and I've told you that before, it's a big issue for us who are interested in clinical trials in lung cancer. It is very hard to convince individuals to participate in those trials. And that's why I want to know more from you as to, is there anything else about your decision to participate in this trial, about the process of being in this trial, anything else that you want to share with us that you think has played a role in the success and how things have evolved for you?
Some of the things that crossed my mind during the trial and in making the decision for the trial was I know that I may be receiving the treatment or I may be receiving a placebo, and I'm not going to know which is what. Every time it came time for another CAT scan or another x-ray, is this working? I wanted guarantees that this is going to take care of the cancer, and there are no guarantees. The opportunity was like buying a product to me. I'm buying this product. I have no idea if it's going to work or not, but it's trying to be marketed, and I'm going to try it, just like a lady that goes to the grocery store, comes out with new detergent. I'm going to try it. I am going to try it. I'm going to try everything I can with this disease, period. And I'm going to live it one day at a time. I'm not going to live in anticipation, and I'm not going to live in the past of being diagnosed. That's a scrambled egg. I'm going to do everything I can with this trial.